Intimate Partner Violence Impact on Mental Health, Project Proposal. Introduction. Intimate partner violence, IPV, is a common problem that affects millions of people across the globe. It includes abuse and aggressive behaviors in romantic or family relationships. About 30% of women report domestic violence as physical or sexual violence, stalking, isolation, economic coercion, or psychological aggression regardless of their race, class, religion, and age. In most cases, IPV is associated with depression, anxiety, and other mental health disorders that challenge the individual's well-being and socialization skills. The effects of physical violence on human emotions and behaviors have been thoroughly studied and examined in many countries. However, not much attention has been paid to the national context and the interventions offered in various countries. Thus, the research question of a future dissertation project will be, are there any similarities and differences between mental health problems caused by domestic violence experienced by American and British women? Literature review. Every year, specific organizations and communities address the problem of domestic violence and the inability to predict it because of multiple personal and social factors. In the United Kingdom, the number of abuse-related crimes has increased by 6% during the last several months, or 845,734 cases in March 2021. In the United States, about 11 million women officially report domestic violence. The World Health Organization identifies several types of violence: physical, sexual, psychological, economic, and stalking. Thus, one of the aspects of domestic violence discussion is the necessity to recognize the types of domestic abuse that could challenge the population. People and help vary depending on situations and participants of domestic violence. Although anyone can be a victim of abuse, women and children are at higher risk. Certain interventions and protocols are created to protect women and other populations, understand the nature of domestic violence, and predict the growth of abusive behaviors in families. Even if people can survive a particular case of violence, mental health problems do not disappear but continue to decrease life quality. Post-traumatic stress disorder, depression, anxiety, or substance abuse are commonly reported diagnoses in victims. It is not easy for individuals to deal with such challenges and return to a normal lifestyle, and additional help and protection might be required. Conclusion. It is usually impossible to conduct original research and communicate with real people to answer the chosen research goal. Thus, a comparison of domestic violence between countries will be based on a systematic review. This explicit method is characterized by thoroughness and clarity in formulating questions and analyzing the existing literature. It is planned to use several bibliographic databases, including Medline, CINAHL, ABSCO, and PsycInfo. The inclusion criteria are full articles written in English and published within the last 10 years. The participants should be females who survived partner abuse, reported a crime, and obtained professional help. The exclusion criteria are systematic reviews, dissertations, non-English papers, and abstracts. The major keywords to work with include domestic violence, partner violence, physical or sexual abuse, stalking, mental health, depression, anxiety, United Kingdom, and United States. The major expectations are to find at least 10 articles to analyze UK and US domestic abuse cases equally.